Lipid disorders. See also related topics. Two-part series on atherosclerosis. Two-part series on prevention of atherosclerosis. Four-part series on anatomy and physiology of the heart. And four-part series on ischemic heart disease. Lipid disorders is a four-part series in the Prescribon medical education series. This video is part 1 in the series. Introduction. Atherosclerotic cardiovascular disease remains the leading cause of death in the developed world. Atherosclerotic cardiovascular disease accounts for about a third of all deaths, and 60% of people will suffer major life-threatening cardiovascular events. The occurrence of atherosclerotic cardiovascular disease is increasing in the developing world, where it's becoming a leading cause of mortality. Atherosclerotic cardiovascular disease is a disease of large and medium-sized arteries. It develops slowly over many years as a direct consequence of several major risk factors. Elevated levels of high blood cholesterol is a causal risk factor for atherosclerotic cardiovascular disease. The accumulation of cholesterol is as oxidized low-density lipoprotein, that is LDL cholesterol, within macrophages in the artery wall has a direct causal role in atherosclerosis. Cholesterol-laden macrophages have a characteristic foamy appearance. Foam cells are a hallmark feature of atherosclerosis. High blood triglycerides, that is triglycerides, are also causally linked to atherosclerotic cardiovascular disease. Unhealthy diet, lack of exercise, hypertension, diabetes, and smoking are other major risk factors associated with atherosclerotic cardiovascular disease. In the countries of the developing world, the risk factors for atherosclerotic cardiovascular disease are becoming more prevalent as their populations espouse a Western lifestyle, and this is likely to be the cause for the increase in disease. Dear listeners, by the way, this educational video is made possible by Prescribon, the makers of e-prescription software for digital prescriptions available freely for doctors on the website www.prescribon.com. Doctors who are interested in this e-prescription can freely avail of its vast collection of more than 100,000 e-prescriptions. What are lipids? Several chemical compounds in food and in the body are classified as lipids, including the following: neutral fat, also known as triglycerides, phospholipids, cholesterol, and a few others of less importance. Lipoproteins are large complexes of lipid and proteins called apolipoproteins. They transport lipid in plasma and other body fluids, lymph, interstitial fluid, between metabolically active tissues. This figure shows the lipoprotein structure. On the outside, the large molecule of lipoprotein called the peripheral apolipoprotein is seen. Bordering the structure of lipoprotein is another type of apolipoprotein called the integral lipoprotein, apolipoprotein, which has B48, B100 or A type. The outside border also consists of phospholipid, free cholesterol. The inner structure is composed of triglycerides and cholesterol esters. This figure shows the structure of lipoprotein. The apolipoproteins are larger structures, both integral and peripheral apolipoproteins. The free cholesterol and cholesterol ester resembling bowling pins, and the phospholipid and triglycerides. The outer shell of lipoproteins consists of lipids, phospholipid and free cholesterol, and apolipoprotein surrounding a core of water insoluble hydrophobic, that is water repellent lipids, that is triglycerides and cholesterol ester. Chemically, the basic lipid moiety of triglycerides and phospholipids is fatty acids, which are long chain hydrocarbon organic acids. Although cholesterol does not contain fatty acid, it is synthesized from portions of fatty acid molecules, thus giving it many of the physical and chemical properties of other lipids. The triglycerides are used in the body mainly to provide energy for the different metabolic processes like carbohydrates. However, some lipids, especially cholesterol, phospholipids, and small amounts of triglycerides, are used to form the membranes of all cells of the body and to perform other essential cellular functions. Basic chemical structure of triglyceride, that is neutral fat. Triglyceride molecule consists of three long chain fatty acid molecules bound to one molecule of glycerol. The three fatty acids most commonly present in the triglycerides of the human body are as follows. 1. Stearic acid, 18 carbon chain, fully saturated with hydrogen atoms. Second, oleic acid, 18 carbon chain, 1 double bond. And palmitic acid, 16 carbon atoms, fully saturated. Transport of lipids in body fluids. Transport of triglycerides and other lipids from the gastrointestinal tract by lymph, the chylomicrons. Almost all the fats in the diet are absorbed from the intestines into the intestinal lymph. During digestion, most triglycerides are split into monoglycerides and fatty acids. Then, while passing through the intestinal epithelial cells, the monoglycerides and fatty acids are synthesized into new molecules of triglycerides that enter the lymph as minute dispersed droplets called chylomicrons, whose diameters are between 0.08 and 0.6 micron. A small amount of apolipoprotein, mainly apolipoprotein B, is adsorbed to the outer surfaces of the chylomicrons. The remainder of the protein molecules project into the surrounding water and thereby increase the suspension stability of the chylomicrons in the lymph fluid and prevent their adherence to the lymphatic vessel walls. Most of the cholesterol and phospholipids are absorbed from the gastrointestinal tract, enter the chylomicrons. Thus, although the chylomicrons are composed principally of triglycerides, they also contain about 9% phospholipids, 3% cholesterol, and 1% apolipoproteins. The chylomicrons are then transported upward through the thoracic duct and emptied into the circulating venous blood at the juncture of the jugular and subclavian veins. Note: lymphatic ducts drain lymph fluid. There are two lymph ducts for the body. Right lymphatic duct drains right side of the head and neck, right side of the chest, and the right upper limb. Thoracic duct, the larger of the two lymph ducts, responsible for lymph drainage from the rest of the entire body. Jugular and subclavian veins. Veins bringing back blood from head, upper chest, and upper body. Removal of the chylomicrons from the blood. About 1 hour after a meal containing large quantities of fat, the chylomicron concentration in the plasma may rise to 1% to 2% of the total plasma. Because of the large size of the chylomicrons, the plasma appears turbid and sometimes yellow. The chylomicrons are rapidly cleared from the blood, so the plasma becomes clear again within a few hours. The fat of the chylomicrons is removed in the following way. Chylomicron triglycerides are hydrolyzed by lipoprotein lipase and fat is stored in adipose tissue. Most of the chylomicrons are removed from the circulating blood as they pass through the capillaries of various tissues, especially adipose tissue, skeletal muscle, and heart. These tissues synthesize the enzyme lipoprotein lipase, which is transported to the surface of the capillary endothelial cells, where it hydrolyzes the triglycerides of the chylomicrons as they come in contact with the endothelial wall, thus releasing fatty acids and glycerol. The fatty acids released from the chylomicrons, being highly miscible with the membranes of the cells, diffuse into the fat cells of the adipose tissue and muscle cells. Once inside these cells, the fatty acids can be used for fuel or again synthesized into triglycerides with new glycerol supplied by the storage cells. The lipase also causes hydrolysis of phospholipids, which also releases fatty acids to be stored in the cells. After the triglycerides are removed from the chylomicrons, the cholesterol-enriched chylomicron remnants are rapidly cleared from the plasma. The chylomicron remnants bind to receptors on endothelial cells in the liver. Apolipoprotein E on the surface of the chylomicron remnants and secreted by liver cells also plays an important role in initiating clearance of these plasma lipoproteins. Dear viewers, this is the end of part 1 of this series. For other parts, see Prescribon Medical Education series, Lipid Disorders.